gave a free webinar for the Facebook group, the Myocardial Bridge Facebook group. And I attended that webinar and I was very impressed. And I scouted out a couple of other surgeons as well, but ended up selecting Dr. Kofidis, which of course meant traveling to Greece surgery. That's been the most number one question people have asked me. Why did you go to Greece?
Well, and take a step back just for a second. If I'm not mistaken, you actually found a couple of surgeons regionally that would be willing to have unroofed you, correct?
Yes. Dr. Alan Stewart is in Miami, and he does these surgeries. He's a very proficient surgeon. I talked with him. I talked with Dr. Guy. Dr. Guy's team also turned me down for surgery. So, it's interesting when you have a myocardial bridge. Not only do you have to figure out the diagnosis, you have to find the surgeons who are willing to work with you.
Mm-hmm.
And some of them are going to, like Stanford, are going to say no.
Yeah, that complication of the forked bridge, in some cases, if they don't feel 100%, they don't want to challenge, the situation and put you at risk either. And then there's others who understand it a little bit differently, are willing to go in and see what they can do. So you get a vacation to Greece.
Yeah. So I scheduled a surgery with Dr. Kofidis at St. Luke's Hospital in November. Did you want to cover something else first?
One thing I know that Dr. Kofidis is giving people, he will do a free analysis. He'll speak with you as a consultation after you send him your CT scan. So did you go through that process first?
Yes. Okay. Yes. Dr. Kofidis will do a free consultation. That's correct. And sent him my images from Stanford, the 3D images which Stanford produces. And other files that he requested. Mm-hmm. And I think that gave him enough confidence that he could handle this case.
So we're in November now, ish.
October. Probably that consultation was in October, and then the surgery was scheduled for November.
So the good news is he was not only in agreement that he felt he could make a difference for you, he was actually willing to get you in relatively quickly. Because for some people, especially in the Stanford program, they may be waiting 6, 8, 9 months, a year, depending on the situation. And here you are, from consult to surgery, maybe a month, 5 weeks.
Yeah, it was very fast. We went back and forth on the timing. He is a professor in Singapore, and he also practices in Greece. And he had to work around his schedule. I was very glad to have it done so quickly, but the scheduling was essentially based on his existing travel schedule. Mm-hmm. So he said, I have a slot here. You can either do it in November in this window, or you can wait till January. And I'm like, okay, I'm going to do November. I don't want to wait till January.
I think we all can relate. If you get two options, one sooner than later, the sooner is the one you're going to choose. Once we get to that tipping point of, there's a fear you could die. We don't know. And there's no surgeon that will say, no, you won't. And, so in our own best interest and self-advocacy, I think everybody I've spoken with, and even everybody I've seen on the Facebook group, except for those people who are so fearful of the process, they really want to do what they can as quickly as they can.
Well, let me say this. I wasn't super afraid of dying. My life had been taken away, right? I was no longer able to work. I was no longer able to go for a walk, the lowest level of exercise. I was spending multiple hours lying on the couch in pain. So, I didn't necessarily think I was going to die. I just felt like I had no life. I felt like my life had been completely taken away. Mm-hmm. I mean, I remember even the littlest would cause a surge of pain. I felt so much disability. I just can't. I just couldn't bear it.
Yeah, there was no quality of life whatsoever.
Yeah, no quality of life.
So you get to Greece, you have your surgery. Let me ask, I know Dr. Kofidis is uh, he does minimally invasive surgery as well as what's necessary in some cases, a full sternotomy. What was your situation?
Yeah, it's interesting. Um, I asked him if we might be better off doing a sternotomy, and he said, "No, I like to do minimally invasive." He prefers minimally invasive. But then he looked at my case closely, and my artery is very small. And in fact, it goes from the left ventricle to slightly over the right ventricle. And he said, "Look, in your case, there's a chance of cutting the heart and causing some bleeding, and I need to be able to get in there and fix it. So what if that happens?" So because of my specific physiology, he actually recommended a full sternotomy.
Mhm.
Right?
And how long was that process? How long were you in Greece from surgery to exit and your ability to return home?
Yeah. So I was in the hospital for 1 week, and then I was in Greece for another week. They wanted to make sure that I was sufficiently stable before making that um, international flight or series of international flights. I will say that even after 2 weeks, I was quite fatigued, and my wife wheelchaired me through all the airports. I probably couldn't have done it without her as my caregiver at that time.
Mhm. Did you notice post-surgery any difference? How quickly was it that you realized, "Man, something's different. This is great," or "This hurts," whatever the
Yeah.
situation may be?
So I've read a lot of stories of people who the day after or maybe a couple of days after they immediately feel this intense um, relief. And my case was much more gradual. I started to feel improvement in the pain. I did start to feel some improvement in the pain right away, but it was more like a gradual improvement. And the shortness of breath actually got worse immediately after the surgery. The way I describe it to my friends is it's like you have a brand new heart and a brand new lungs that have never been used before, and you have to train them to work from the beginning. That's what it felt like. I was always out of breath that first 2 weeks, always. Um, but it came back pretty quickly. Um, and what I'm really amazed now because I was expecting, because my physiology is complex, because my diagnosis is complex, I was expecting maybe I would get like a 40 or 50% improvement. I feel like I've got a 90, 95%. I can't believe how successful this surgery was. I'm just, every day I'm bowled over.
I mean, that's the greatest thing to hear. I mean, for me, for Dr. Kofidis, I'm sure,
Yes.
and I know he's engaged with the group, from a distance because he can't engage and give any advice. But I'm sure he just loves to hear these stories where the process that maybe was a little too risky or a little too concerning for others, where he's able to go in and do the procedure and it works. And this is just November, so you're 5 months out?
Yeah, I'm 5 months out, right? So I don't think I've reached my upper limit of what I can do yet. I mean,
Mm,
I can walk without limit in terms of distance. I'm walking as fast as I've ever walked and having no pain. And a bit of a tangent, but you know, I had I had quit caffeine entirely because that was one of the triggers. And I find that I'm actually able to drink a cup of tea now and still not have pain. So life's little pleasures.
agreed. I did the same, and I love coffee, and I was never more than a cup a day guy, and not even every day. But when you don't know what's wrong with you, and most of us stop everything. I stopped any vitamins, I stopped supplements, I stopped everything,
Yep.
including coffee, anything that could have an effect. And it was that first cup, you're a little bit anxious. What's it going to do? Is my heart going to race? Do I dare have a cup of coffee? Because it seemed to create symptoms before. And I actually had my first cup in the hospital. It's like, okay, I'm going to try this while I'm here, as long as I'm, I mean, I've got somebody around me just in case. And I was thrilled that nothing happened. I mean,
Oh, that's great.
I don't even know if it increased my heart rate at that point. So as you pass through your sternal precautions now and everything, you're driving, you could actually ride your bike if you chose to. Are you in cardiac rehab yet?
Oh, I did a couple weeks of cardiac rehab, um, and it's mostly just cardiac exercise while wearing a monitor,
Mhm.
and they never saw anything. Which doesn't surprise me because they never saw anything before the surgery either. So they never saw anything that was concerning. So after a couple of weeks, I felt like I can pretty much do this on my own. I mean, I haven't had a chance to do these things yet, but I expect to start biking soon. I expect to start yoga again soon. I actually think I'm going to do some jogging again soon. So, I don't feel like I feel like I'm only constrained by the fact that I was um, uh, sedentary for a whole year, right? I was
Right.
lying down for a whole year. Now I'm coming back and able to do things, and I don't feel really constrained.
Can I ask you, you mentioned that insurance would cover Stanford because they were in network. Greece is out of country, so I'm sure that there was some challenges there. How did you go about the expense of the surgery and everything?
Yeah, so insurance did not cover any of costs for surgery. Um, I'm fortunate that we have some savings, some means. We just paid for it. We just paid for it out of pocket. I will say that paying for something out of pocket in Greece is probably a quarter or a fifth what it would be in the United States.
Mhm.
There's a cost savings because it's in Greece, but it's a significant chunk of change. But you know, I can't. Looking back, I can't think of any money that has been better spent in my whole
Well, and yeah, that I would say at whatever cost your life, right?
life. I got my life back. I got my life back. So that there's almost no cost that wouldn't be worth that.
Yeah, and so many
Yeah,
people, work, they spend their health to gain wealth, only to
yeah,
find at some point they're spending their wealth to get the health. And,
yeah.
in your case, it's great that you were able to be able to carry that.
I feel very, very fortunate that we were able to with that cost.
So
Um,
for the benefit of anybody that's now engaged in this discussion going, well, I can't find anybody locally. I don't want to wait 9 months to get to Stanford or a year, whatever the case may be. The Greece experience was a good one, all the way through from the hospital to the exit.
yeah, so at St. Luke's Hospital, the, I was really amazed at the level of care that they provide. I've been, because of my heart condition, I've been in the hospital many, many times. And it was shocking to me to be in a hospital where you would push that call button and someone would come within 2 minutes. I've never experienced anything like that. It was phenomenal. The level of care was very high. Even the food, I had actually had a door to the outside, some fresh air. I got fresh air and pretty and nice food. Um, it was a very good experience. The doctors were extremely professional throughout the entire experience and spoke perfect English. It was the hardest part was getting there and getting home. It's not that easy to get to Thessaloniki from Miami, and it's not that easy to do when you're feeling badly.
Right. Yeah, that even more so, that's the exaggeration right there. That's the exclamation point on it, to have to get on a plane and sit for, 8, 10, 12 hours, assuming it was a direct, but you probably had to make a stop somewhere too, right?
Yeah, it was 3 legs. It was 3 legs total.
Ugh.
Yeah, we paid for the economy plus or something like that, so we have seats that have a little more space on the way there.
Yeah.